Hello, my name is Kevin Nicholson. I'm the Director of Therapy Services for Vibra Rehabilitation Hospital, and today I'd like to visit with you briefly about the topic of spinal cord injuries. This is also what we call SCI for short, spinal cord injuries. Pretty much everyone knows that sometimes a spinal cord injury can result in paralysis or loss of the ability to move the arms and or the legs. When this happens, there are also changes that occur over time due to the spinal cord injury that can affect the largest organ of the body, and that organ is the skin. After a spinal cord injury, changes occur in the skin. The substance that gives strength to the skin, something called collagen, can start to decrease, and also blood supply to the skin can decrease in some instances. Also, because of the paralysis, muscle size starts to decrease. The muscle will oftentimes be replaced with an increase in the layer of fat where the muscle used to be. The perception of sensation, or the ability to feel touch and other sensations on the skin, can be affected as well. These changes can make someone more susceptible to what's called a pressure injury. Typically, the bony prominences, the bony areas of the body, of the skeleton, rest on muscle tissue. The muscle tissue will then disperse any pressure that occurs from sitting or laying on a bony prominence. However, with the changes in associated with a spinal cord injury over time, there is an increase in fat tissue. With pressure, the fat tissue can actually compress, and that actually gives more pressure to the bony prominence areas. The result can be a really nasty pressure injury or wound. So you have to be very careful of that. If you or your loved one have suffered a spinal cord injury and have some degree of paralysis. Here are some of the areas to watch for possible breakdown of the skin. When laying on your side, you should watch for the bony areas between the ankles, also the bony areas on the outside of the ankles. The same applies for the knees, the bony areas between the knees as well as on the outside of the knees. Also the hip bones, shoulders, and your ears. These areas, although the ear is not a bony area, it can still suffer a pressure injury from laying on your side for a prolonged period of time. When you're lying on your back, bony areas to be concerned with are the heels, the tailbone, elbows, the back of the head. And then finally, whenever sitting, you have to watch the shoulder blades, the tailbones, the bones on your bottoms, right in the middle of the buttocks. Those areas are prone to pressure injuries too, as well as areas of the feet. Again, the heels can be areas that can be subjected to pressure injury. If you notice any changes to skin in these areas, you should contact your healthcare provider immediately for further assessment. Thank you for watching.